Good.
I don't really remember what it's like not to have pain.
Wow. I'll give you a minute. Wow. Stopped work because of the pain.
I'm fully off work, yeah.
Wow.
If I go to a restaurant and it's busy and loud, I get migraines. If I'm just in a crowd, I get migraines. If I'm under stress, I get migraines. And I have 3 small kids.
So when's the last time you didn't have neck pain?
Oh, I always.
How long have you been following you now for?
Well, my husband's been following
Okay.
you for a few years. And I just, when he reminded me of this appointment, a couple months ago, I started following you on Instagram.
Nice.
And then I stopped.
Because you're not, okay, I got it.
Because it was a little intense.
Sure, no, I get it. Whenever people see that kind of stuff, it's a little different, but like I said, it's not the same for everybody. And really more than anything, just to give you some confidence, we've been doing this for about 9 years now. I've seen thousands of people, and probably like some of the worst, because people will try, like I have a woman right now, I think today's her last visit, but she came from Australia. And so we see so many people from around the world, and because we see a lot of people in these like really bad states. So migraines, I've seen people that have had migraines for 50 years, 40 years, 65 years, and we get great results with them. Not because we're just treating a specific area of the body, but we're treating it globally. I know you've been through upper cervical chiropractors.
Yeah, I've been to lots of everybody, all different types of practitioners.
Yeah.
And I do get the most relief from my current chiro who does a cervical adjustment. Like Nuka didn't really work. But that's when, like if I wake up and I have a migraine, I can get in to see him right away if he's working, and he does that, and I'd say 80% of the time within a couple hours my migraine releases.
Okay.
Like all the muscles, it's an instant release, but then the muscles kind of follow. Yeah, so that is the most effective. But it's why isn't it staying, right?
I'll go over it with you here because I think the migraines have been a big thing, but I do want to ask you a little bit more about the accident that happened in 2013 and then the fall that happened as well.
So I was the passenger in the not at fault vehicle, but we were driving not very fast. We had just turned onto a road and a girl ran a stop sign. And so just all of a sudden she was in front of us and we T-boned her. Okay. We did a bit of a twist, right? So my body would have like twisted. Both cars were written off, but we walked away. And then, by that evening I started getting stiff. By the next day I was worse. The next day I went to the doctor and kind of started on your typical like physio, chiro, massage circuit, but I started having jaw problems and I didn't make the connection to the accident until I finally saw the jaw specialist, and he's like, were you in any trauma? Did you have an accident? Oh yeah. And so he adjusted my jaw just with an orthotic, and then the neck and back weren't too bad. But once the jaw adjusted, the jaw got significantly better, the neck started bothering me. And I was a teacher at the time. So like writing on the board, like I started getting pain down my arm and these migraines.
Wow.
And I started accommodating myself at school and using a tablet and doing all these things. And that went on for a few years. Like I didn't go off work till 2018 and the accident happened in 2013.
You stopped work because of the pain?
I'm fully off work, yeah.
Wow.
In 2018, I went down to halftime. I was doing physio. I did cervical injections, facet injections, greater occipital nerve injections, PRP, Prolo. I had a pneumothorax from an intercostal injection. I was in the hospital for a week.
Oh gosh.
I've kind of done all the things and saw all the things. And then it was probably about 2018, 2019 when I went off work full time because my migraines were so bad. I did all the drugs. And then I started getting more holistic. While I had seen chiro, I started seeing more chiro, osteo, acupuncture, like more traditional Chinese acupuncture as opposed to like intramuscular stimulation acupuncture, and just stopped working. And I've kind of learned to manage my life to minimize the pain. But it definitely, if I went back to a classroom, like I couldn't handle it. If I go to a restaurant and it's busy and loud, I get migraines. If I'm just in a crowd, I get migraines. If I'm under stress, I get migraines.
So basically like your body's not integrating anything from the outside world right now?
No.
Wow.
No, and I even noticed I've had my hearing checked because I find that I have to really work to tune out atmospheric noise and focus on a conversation, or like even if my husband and I go to dinner with another couple and they're having a side convo, like that's really hard for me. And I have 3 small kids.
Oh my gosh.
So they're really good. I mean, I've raised them to be like, they're quiet in the house, they're allowed to be loud outside, and we just stick close to home. What I lift, how I move, what I do around the house. Like I have help, luckily. I'm fortunate to have help with the kids and help in the house. Laundry, dishes, things like that.
It's taken over your life, is what it
yeah.
seems like, yeah.
Yeah.
Well, that's a lot. No, that's honestly a lot, yeah. I feel for you. I mean,
Thank you.
that's so much. I just kind of, I hate that that's had to happen to you ever since that car accident and just kind of shifted. You know, I think there's always a way out, and I think the fact that you've been going more of the holistic route is great. There's so many things out there, and there's so many things that, you know, that you try, and I think the good news is that you keep trying, you keep trying, you keep trying, and now your husband's like, hey, come do this. But there are different ways that I think that we can also approach it that you can also add to what's going on with you. But whenever I am going to address you here today, we're going to take a little bit of a different approach with it, because I think when I look at somebody, I look at it more like globally. And I think and I'm just going to kind of go into it more in a second here, because we want to make sure that we're addressing the whole thing and not just like a couple of points than anything. How do you feel like, I mean, obviously it's impacted your life now. Mentally though, like it has to be kind of straining, yeah?
Yeah.
Yeah.
I'm actually doing fairly well, all considering. Like when I went off work in 2018, I was really mentally not well. Friends took me on a vacation to Maui and I met my husband on the beach.
That's amazing.
Like, and I was like lowest of the low. And then boom, like I had 3 kids, and I had previously had a partner, my previous partner passed away.
I'm so sorry.
So I had gone through that, and then I had gone through, my dad was in a car accident when I was 22, and I was primary caregiver for him for 10 years before he passed away. Like he was life support, in a coma, ended up hemiplegic. So I had a lot of stress. So then the accident was kind of like, it didn't seem that big of a deal, but it is. Do you know, because I had people die on me.
Yeah.
And so
you've gotten numb to it.
Yeah, a little bit. And so it's just been recently, also with the help of my husband pushing me to recognize that, well, I've seen therapists, like psychological therapists, to recognize the stress of this, because my brain logically says I have these 3 beautiful children who I adore, and yes, I miss my job like crazy. I loved my job, and so that was hard to lose that too. But I have these kids that I didn't think I was going to have, and so that's not stressful, right? I had people die on me, and I like that's stressful. I finally just started to realize, okay, yeah, having 3 little kids can be stressful, and I can like feel that. So I'm just getting to the emotional piece of this. There was a lawsuit that went on for 11 years.
Wow.
With the car accident that just settled. So that was a lot too, and that just settled last year, and I was hoping for a leap when that was done and over with, and I maybe got a bit of it.
During this whole process, you've probably not just become numb to like your symptoms, but you've become kind of numb to yourself. And it seems like a lot of the emotional stuff that you've probably needed to feel, you know, with your dad, with the accident, with all these different things, probably got stuffed away a little bit because of the pain. And then having kids, like you can't, like I have a newborn right now, like you just, whatever the kids need, like that's what we're gonna do.
Yeah.
But I think that's good that now that you're kind of recognizing it, and I think that leap happens as you start to take more accountability of what you're actually feeling. I think in this society, more than anything, we get used to, like the terms that I, like there's a phrase, like I got used to it. I hate it so much because we lose ourselves and we lose like our standard, and we don't know how to live to that standard because now that standard and that line has become so muddy. And when it becomes muddy, you're like, yeah, I'll let this happen, I'll let this happen, I won't take this, and I'll just let it brush off. But in reality, you're still chipping at the block. And then you get to this point where now the stress and all of it, it's like, where do I even begin? What do I do? Yeah. Where do I start? I see it time and time again. I've had it happen in my own life as well too. When I was 21, I had like severe issues. They told me I needed back surgery, I had sciatica down both legs, I fell into a bad depression, like my relationships were gone, like everything was awful. I was just miserable. And when somebody explained the x-rays the way that I'm going to explain to you, it just changed my life, because it was like a different way of looking at it that no one's ever said to me. And I went through like 20 different chiropractors trying to figure it out. And I was like how many more am I going to go through? And I've done through osteopaths, I've gone through neurologists, like everything. Yeah. And I'm just kind of burnt out. Like, what am I going to do? So I think more than anything, we always want to bring what your body was. Like there's an ideal way of how your body's supposed to be. And whenever you go through accidents, and you go through different traumas, you go through falls, deaths, like loved ones, like everything, that all impacts how your body is. So a component of why you're feeling the way that you're feeling isn't just because of the physical nature of it. I tell people, your body, the way that you are physically presenting to me, your manifestation is a manifestation of you physically, mentally, socially, and spiritually. All of that, once you're able to tackle every single one, that's when you are truly aligned with your body and your health. And as you continue, you don't have to be 100% in everything, but as you start to battle each one, you'll start to see that leap that you're talking about. That's where we want to kind of intervene physically with you. But sometimes this becomes a very emotional, sometimes it becomes a very spiritual thing with us whenever we do adjust somebody, because of all the trauma that just gets locked in your spine. You hold that whether you realize it, I'm sure you realize it, but whether you realize it or not. Right?
There's realizing it, and then there's actually
doing something,
Yeah.
And I think it's great that you've been getting adjusted. I want you to continue getting adjusted. What we want to do is just add and hopefully do something different with you here today. So do you have neck pain today, by the way? Yeah. Scale from 0 to 10. How bad is the neck pain?
About a 3, 4.
About 3? Okay.
Yeah.
So when's the last time you didn't have neck pain?
Oh, I always. Well, I mean, I'd say probably since the accident. I'm not really sure. The migraines were so bad for a period of time that I didn't even recognize the neck pain until I got the migraines under control. And then I was like, oh, my neck really hurts. And now I can identify that it's the neck causing the migraines. So when my neck gets worse, like yesterday, travel day, kids on plane, like full left side.
Wow.
Last Sunday, I was full right side. Like I was in bed all day. Had to take meds and.
Gosh.
Yeah. So it's I get them like one-sided or the other.
That's rough. Very rough. So normal, it's supposed to look like this. And there's a chart basically, and I'll just kind of briefly go through this. But you want to have a curvature that arcs backwards. This is what it's supposed to look like I was showing you over here. Nice curve, you can see. Even like these bones over here, they're nice and tall. They can stack. It looks like it can stack. When you go in through here and it starts to lose that curve, do you see how like the bones, the discs first of all, start to decrease a lot? And then at some point, the bones will actually start to shift and change and become osteophytic. I don't know if that's a word. And then eventually, it just becomes fused altogether. And so we want to make sure that that doesn't happen. And so the way that we make sure that doesn't happen is by regaining a curve. That curve is not regained by just adjustments alone and just by exercise alone. It cannot regain it that way. There has to be some sort of intervention that then hit, because what people don't realize is that in this spine, there are long, strong ligaments, nuchal ligaments, dentate, like inside, that have become so scar tissued up, especially from that accident, that it's hard for just it to open backwards the opposite way. So there has to be some sort of constant pressure. So the reasons like you'll wake up with pain and you're like, well, why doesn't it stick, right? Why doesn't it stick is because a lot of times that curve is never addressed and it was never put back in the same position. So you're addressing just now the symptom of what happened, the root cause of it. So the more you just continue to address like the symptom, like it just keeps coming back, and people are like, what the heck? I don't want this to come back. This, along with the musculature and the integrity of it, need to return back to its opposite position. Okay, so this is yours, and then this is what it's supposed to look like here. And that yellow line is showing where that curve should be instead. Another thing that I'm seeing here, this is kind of what I wanted to show, and it's what kind of took me a while to look at you. So one of the things that I've noticed when I'm looking at you, do you see these little, like, look like teardrop things?
Yeah.
So the teardrop things start to go to that left side a lot and then come back to that right side. So what it seems is that from your x-rays that your head has been jammed this way and it's pushing in and rotating forward. So it's like crunched inwards. So when you go to upper cervical chiropractors, they don't really adjust the occiput. What they adjust a lot of times is just atlas or even C2 sometimes. And so if you've been getting atlas adjusted, right, and it feels good afterwards, but it returns back, the one thing that a lot of them don't adjust is occiput. And occiput seems, to be honest with you, how far down that is causing this to drop inwards, and that force is now driving into that left side, causing you to have this weirdness to the rest of that body as well too. So what I'm going to be adjusting on you, as long as it checks out what I'm feeling with my hands, I'm going to be adjusting occiput and probably around 1, 2, 3, 4, C5 on that left side. So I'm going to talk you through what I'm feeling. Do you see when I press here, like I can just kind of touch your spine pretty easily? As I work my way down, you'll see a little bit more of a resistance, especially right through here. See how like this one's it feels like muscle, but in reality what it's doing is that this bone right here has a lot of inflammation and it's pushing outwards. And there's a lot of fixation is what we call it, and I can feel that in there. This is the occiput right up top where I'm contacting. You can feel this. but then feel how much more tighter this is comparatively to this. Like I can sink in here and I can't sink in at all.
I get a lot of pain there too. Like that's where it comes up and over in the migraines. Like,
yeah. So
like a lot of nerve stuff.
Occipital stuff.
Yes.
All right in through there. Let's have you do a few tests. Look to the right. Stop before you have to force it. Okay, so the nose is about 65 degrees here. We want to be closer to 80, back over here. Look to the left. A little bit better there, like 70. No, it's about the same almost. Is there one side that hurts more than the other?
Overall, no. It kind of it just tends to like flip back and forth.
Okay.
But I get like as I do that, there's like cracking in my spine. Like I can hear it crunching.
Gotcha. Let's have you look all the way up to the ceiling. Is there any pain when you do that?
Yeah, like
in your mid back?
Yeah, like upper thoracic.
Gotcha.
Kind of.
Do you have pain there normally? You can relax.
Yeah.
Okay. A little pain in lower back also?
I have had lower back, but not as, it's
not right
more
now.
Manageable.
Okay, so you still have it?
Yeah.
Okay.
I have it.
Yeah.
It's
so we're not ignoring it. It's still there, right? Okay. We'll address it. Let's have you stand up now too. Try and touch your toes for me.
Just this way?
Does that hurt your back, neck, upper back, anything?
It hurts my neck, yeah.
Hurts your neck right there?
Yeah.
Okay. Sit back up. Any issues walking?
Like I have some balance issues.
Somewhat? Balance issues? Do you have balance issues right now?
A little bit.
Okay,
yeah.
Can I see it? Close your eyes though. Let's do something different. March in place for me. Okay, keep going. Alright. And clap, stop, open your eyes. Okay, so you're straight. So that's telling us it's not so much a brain thing than it is a physical thing.
Okay.
Go face down. And from here, I want you to keep the left leg straight. And lift the left leg up as high as you can go. Yeah. Is that painful?
Yeah.
Yeah, go back down. Where does it hurt?
Lower back.
Right there? Okay. Let's have you do the right side. Lift it up. Easier or harder for you?
Harder.
Harder. Okay, go back down. So we're just letting your legs just bend. Nice and easy. Yeah. A little tougher on this left side, right? So you see how I can get closer to your butt here? This one's not really moving. Well, and so now I'm gonna check, see what the sacrum is. Yep, all sacrum. Not just sacrum, just kind of everything. This whole side feels rough. So I'm gonna push in here, okay? The table is going to pop up underneath of you, okay? So all we're doing here is just pushing down with the table to help open this up. Now your sacrum is just kind of locked like that. Does that hurt? Hurts?
Yeah, it doesn't feel good.
Okay. I'll try and contact a little bit more broad. Is that okay right there? Okay, here we go. Still okay? Good. Left leg all the way up. Good. And right side. Good. So what I want you to do is you are gonna lay on your back. So we're gonna go right in here. Good. You're gonna let your head. That's it. Easier on the chest. Loosen the shoulders more. Yeah. Be alright. Good. Loosen that stomach. Now press down. Yeah. Easier. Oh. Wow. That was good.
That's what I didn't want. No, it was good. It was good. It was fine. It was like, it was, yeah, a little scary.
A little scary?
Yeah, it's okay though. Okay. It was good.
Not too bad, right?
No, it's totally the anticipation. It's all the anticipation. I've had a lot of painful procedures. It's not painful.
Have you had adjustments that were painful?
Not so much chiro. No, like not more of the holistic stuff.
Okay.
But injection after injection after injection, like under X-rays and. Then
so that's where like the nervousness comes from.
Yeah.
Like,
so it's just kind of around practitioners. I get nervous.
Okay.
Like the pneumothorax was big because I was also 12 weeks pregnant and had to have like 14 X-rays and had to have a chest tube inserted with no anesthetic because I didn't know what was going to do. It was my first baby too. So that was very traumatic.
Okay. If I had a suit and tie, would that make you more nervous?
Maybe a little.
Yeah.
Yeah. And the cracking. Do you know,
And the
like there's
crack,
just
yeah.
this, prior to seeing chiro, I didn't see chiros for a long time because of the whole cracking scares me.
Yeah.
Like I never cracked my knuckles. Like,
I get it.
however, I know it helps.
Yeah, it helps, especially if it's directed in the correct place, right? We're gonna go a little bit higher now, okay? Let's have you put your head down. Okay. Good. And we're gonna lay all the way back. That's good right there. Good. Do me a favor, bend your knees for me. That's great. And I'm just gonna tissue pull a little bit there. Yeah, chin down a little bit. That's easier. Let it relax in there. Okay, so we're just gonna push in there. Okay, good. Not bad. There we go. So we're gonna come back here in a little bit. I want you to lay on your side, and you're gonna face to the right. And so what we're gonna do is adjust that lower back. So that right side.
I'm getting a headache right now.
Okay. That's okay. So things, as we start, especially like in the sympathetic chain, as we do that, it's gonna like start having all these different symptoms with it, because I think your body's been running on that sympathetic system the whole time. So we still haven't like adjusted that chain up top, and we'll get there at some point. So L5 is what we're going to be adjusting, and you're gonna feel this like compression in there, okay? And you're gonna feel like you're gonna fall, but I got you. Right here, easier. Good. A little more, right there, good. Good. Not bad, right? Good?
Still here.
All right. Now, let's have you on your back again. So that right occiput is jammed, right? So I need to open that right occiput a little bit here. There we go. Just gotta get your hair out of the way.
There's a lot of it, sorry.
That's okay. Better to have a lot of it than none of it, right?
Mm-hmm.
So we're just finding where the opening it is for you. Claiming, huh?
Mm-hmm.
Let's go. See here. Breathe into the chest. Yeah. Doing good. Good. Wow. That was a big one, yeah. What's going on?
Just like, it's just all very nerve-wracking.
Yeah. You're doing good here. I'm not gonna make you
I shouldn't have worn mascara, I guess.
That's okay. How did that feel?
It was big.
Yeah, that was a big one.
Like it was a big release. I'm still just like so anxious that
That's okay. We're gonna
like
let
all my muscles are, do you know what I mean?
Yeah. I'm gonna let your body, we're not gonna move on yet. That right side, remember I was telling you that whole thing was just being compressed right there? Mm-hmm. That's exactly where we just adjusted to open that thing back up.
Yeah, it was like so much. Like
Yeah.
I felt it on both sides.
Mm-hmm.
Just really snap, crackle, pop.
Do you feel like the tears are from like the anticipation, or do you feel like you're feeling something afterwards?
I think it was probably all of the above. It's
Yeah.
like when you're in this just state of stress for years. The other thing is that I've seen a lot of practitioners with high hopes. There was years after the accident of like, oh my God, this one's gonna fix me. Even like the first cervical injection.
Mm-hmm.
Such relief. I was like, oh my God, like we're
Yeah.
finally there. We finally got it. And then it didn't last.
Yeah.
Or the subsequent ones didn't work. So I kind of just hit a point where I like didn't look to fix, and I got better mentally in a way of managing. Okay, I'm just gonna manage my pain for the rest of my life.
Yeah.
So anytime I see someone new, I think there's this underlying like maybe it will.
I see a lot of people, so I can feel a lot of the energy in the block, and it wasn't that I don't think that you didn't not want to be here, but there was some anticipation, but also some skepticism because of stuff that's happened from before.
Yeah.
And that's kind of like, I was like, the way I'm feeling, where it's just like, okay, like I feel like she wants to be here, but it's hard to be here.
It's scared to let go.
Yes.
It's scared, like when your body is in this state forever, it's hard to let go.
Yeah.
Like I don't really remember what it's like not to have pain.
And I think right now, as you're like tearing up, you're trying not to let go.
And I don't cry well because it was all the other trauma before the accident, right?
Yeah.
But my husband, yeah, I wouldn't have come, right? Like I would have watched your videos, I wouldn't have come.
That's okay, no offense.
But he's the most beautiful human I've ever had in my life, and I trust him completely, and So, yeah. It's hard that he's not here because of the kids. He had to.
What's his name?
Dan.
Dan. Well, Dan's an amazing guy.
I mean, he's out there.
Yeah,
But
I'll make sure we say hello to Dan and thank him for bringing him in. But same woman that's coming from Australia, her husband brought her. Like she watched my video, she wanted to see, but he was like, we're just gonna do it, and we're gonna do it. And she was like bedridden for like 3 months, like she couldn't get up, nothing. And she's like walking in here doing some crazy stuff. She wild. She's awesome. And I think if I can say anything, it's just like continue to be vulnerable. I think
I'm not very good at that.
Yeah.
And that's when we talk about the like childhood parent issues. So.
that's where it comes from. But I don't think you have to be vulnerable to everybody. You just have to be vulnerable to the people that you feel like you should be to. How are we doing?
Good, I'm good.
How's it feeling though?
Yeah, it feels good. I still I feel kind of banana to the right.
Mm-hmm.
Am I?
Yeah, because we haven't adjusted this area yet.
Okay.
But yeah, that was good.
The Occiput, like they did injections there too, but they're just numbing the nerves. Like that's where I often feel migraines. Like I know it comes from there. And for so long to the regular doctors, I was saying like it's C1, right? It's higher up. It's in here, and they're like
it's C0.
They just
really
numb the pain.
Yeah.
They just numb the nerves. Like nobody really, other than chiros and osteo, like start getting to like, well, yeah, let's get to the root.
So C0, we call that the occiput. So this thing, if you look down here, right, I can see you through here.
Yeah.
There is a brainstem that goes through here. So anytime this like shifts like this, and I can't see anymore, it shifts like this, it causes a lot of the issues that you're talking about.
Totally.
So when this isn't addressed, like there are condyles through here and through here, you can continue to adjust the atlas, but the thing is sometimes that occiput has been so stuck to this that it's causing that atlas to go
So
somewhere.
I didn't know like how are you adjusting? I didn't know you could adjust the occiput.
Yeah. So right now your occiput was down like this.
Okay.
And so what I did is I took my hand and literally went like,
Okay.
and open. That's why you felt that
Yeah.
big release into there, is because we try to open this up finally. There. I think people have been hitting your atlas. You've been to upper cervical chiros. Upper cervical chiros are very C1 dominated. Sometimes they'll hit C2, but they don't really hit occiput that much. And I think the occiput is one of those underlying like key that your body really needs to help open that up more.
For sure. Like I've
Yeah.
felt that for years.
So trust your gut, trust your intuition, right?
What I know now, if I hadn't known how many years ago,
Yeah.
would just be a big difference.
Yeah.
I would have handled things a lot differently.
This is life, right? But
Especially
you have
the
kids.
drugs. Like
Yeah.
the drugs and more drugs and side effects of drugs and more drugs for the side effects of drugs. I had stomach ulcers. It was...
The third leading cause of death in the United States, medical malpractice and prescription drug reaction deaths, right?
I've since learned.
Nobody tells you that.
No.
I'll tell you about the Cairo horror stories though. Not about the good ones.
About the what?
The Cairo horror stories.
No, don't tell me that.
No. There's not many. So now when I press on you, how does that feel?
That feels totally fine.
Feels different, right?
Yeah.
Amazing.
Yeah, actually. Like that's
Yeah.
always, like, I massage there, I put oil on there, I like do everything, and that
Someone just
doesn't
needed to
feel-
take your head and just go through. Good. How's your headache?
It's gone.
So I think after we opened this part up, it was like, okay, I'm free, and now that all the energy was like pushed up, and you're like, now I'm getting that headache. And I'm like, okay. So that's why I just did one side and do the other side of this, because this needed priority now. Let's now have you sit up and face towards Ken. This feels way better compared to when I first touched you. When I touched you, like there was like so much gunk. Can we use gunk? Yeah, gunk.
Yeah.
Gunk. We didn't like the gunk.
It's a medical term, right?
I think so. I think if it's not, it should be. I think gunk is one of those things that you could apply to anything.
So many things.
So many things.
I wiped a lot of gunk off my kid's face this morning.
Scoot forward a little. My kid is 10 months.
Oh.
About to hit 10
Oh,
months.
they're so perfect.
They're perfect.
So much. They just become so personable and fun, and
I say hi, and he's like, hey.
yeah. Just wait. The next like 6 months are great.
Yeah.
And they go wild.
Yeah.
Feral. But if it's your first
Yeah.
boy or he, you said?
He. Yeah.
Yeah, he'll be fine.
Yeah. We want to have another one here soon.
Yeah, the youngest is. My 1 is great. My 2 is good. My 3 is like climbing the walls. She's probably climbing the building outside right now.
That's okay. That's why like we have a big waiting room. So we call this entire segment, meaning like your whole spine has shifted to this left side. And we're just seeing where, I'm gonna go one segment up because we're gonna lift, here. Easier on that shoulder. Drop your head down a little bit towards this way. Wow. I'll give you a minute. Wow.
That's the one I didn't want you to do.
Nice. It's okay. You okay? What are you feeling?
Honestly,
Yeah, no,
my
be
biggest
honest.
fear, because you know, like your fear and your anxieties take over, and it's like I try to tap into my intuition versus fear, and the difference, finding the difference between those two is hard. So my biggest fears coming in here were that I was gonna like walk out paraplegic,
No,
or not walk out.
Yeah.
Like it just, again, like I found my people I trust. So anything new gives me a lot of anxiety. So that adjustment specifically, I was like, oh my God, what if it goes wrong? What if? So it's done. I can move all my limbs.
You're right.
Yeah. And then it was just a big release too. Like,
So let's tap in past the fear now. How are we feeling internally after that? Because I know that was a big adjustment, right?
it feels weird. I'm not actually sure how it feels.
Okay.
Because I still feel it here, and then I feel it here. I think if you've put me in a proper position, I don't know what that's like. Do you know what I mean?
Yeah.
Like I feel a bit like my brain is
like you
saying
don't know what
like
to
you're
do right
leaning
now.
this way a bit.
Yeah. So I think a part of it is just like all the ligaments and the muscles have been in such like a specific state for so long. Have you been adjusted like that before?
Not like, no, just the constant.
Okay. As chiropractic has gone on, there's different adjustments that start to happen. With you, like that was a big adjustment because we were really going like that whole thing was just shifted this way. So not only did it push this way, but now you feel a little here and here because it's like, wait a minute, I'm not used to being in this center position like you were saying.
Yeah. Yeah, like it feels right.
Yeah.
But my brain is struggling to be right.
Sure.
You know? Like my brain had got accustomed to like being a little janky.
Yeah, and that's the part of like the adjustment and the block. So the sounds of those two, they were deep. They weren't just like click, 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 right? They were deep. When you hear something that's deep, that's how we know we've made a change in that system.
It's like the muscles just over the next couple hours start to like let
Open
go,
up.
and I feel good because they're just holding on so tightly.
Yeah. Okay. So after that adjustment, your body's still trying to figure out what to do. We like to go in. Let's open it up a little bit here. Great. Let's recheck you, okay?
Okay.
Let's have you look to the right again. It's 100% now.
Yeah.
Left. It's 100% now.
Wow.
Yeah.
Totally. There's not even a pull.
Yeah.
Like it hasn't been like that. I don't know. Like definitely because I've been assessed, like especially with the lawsuit, I've been assessed by so many people, right? And they do all the range of motions, and it's never been that much.
Now you can look at your kids. Where are they?
It's fine. I got eyes in the back of my head, so it's been okay. But
you know, just to go on that, I think mother's intuition is crazy.
They do.
Like my wife, she was like cooking yesterday, and my kid was like playing. I didn't think, and she was like, "He's tired. I need you to bring him up." I'm like,
"Oh yeah."
What? And like as soon as she said that, he was like, and I'm like, "What is going on? That's crazy." So I tell her, I'm like, you know, I know there's doctors and what they might say and whatnot, but I was like, we always want to listen to what your intuition says. What your intuition says about what we're supposed to do with him is what we're going to follow regardless.
Totally.
Let's have you lay on your back. We're going to do one more on you, okay?
Okay.
I just want this to open the rest of that spine down. But I think after we've opened that occiput and that neck, we're going to feel a little bit more this way here. Okay. So people always ask, like, why do you use the wash strap, or why do you use a towel, or why do you use your hands? It's all patient dependent. I want to make sure that person is the most comfortable. Deep breath in right here. Exhale out. Yeah.
Oh. That got my lower back. Was that supposed to get
Yeah.
I'm like, it got up here and down here. I was worried about that with my jaw too. But it was okay.
It was good.
Okay.
You're all right.
I'm trusting you more.
She might come back. You never know.
I might come back.
How's it feeling now?
Good. yeah, I kind of want to like just see how it goes, you know?
Yeah.
Like even sitting sideways and looking at you.
Mm-hmm.
So for
tough.
years
Yeah.
that I always had to, when I talk to someone, I have to sit straight on. And I would position, I just have to move my own body all the time. Like sit across from someone, move in a room.
Yeah.
And I was turning my head towards you. So at the beginning of the appointment, I had to turn my whole body towards you. And
Yeah.
I turn my head towards you and it's fine. Like I'm just always moving my neck and like
Yeah.
stretching, and even during the x-rays. And this is weird.
That's why we take a lot of pride in what we do. It's my 9th year, but I've been to a lot of seminars, even, and it's like every month I still go to one, because we're still trying to evolve and become better. I think we owe it to our patients, especially when you're coming from Canada, to give you the best.
And we're not really supposed to be coming down here right now. Thank you.
There's a whole 200% tariff tax on today's visit.
Okay, yeah, probably.
There's not. All right, how are we feeling?
I feel good.
Yeah?
Yeah.
When's the last time you said that?
I don't know. Honestly, I don't know.
That's amazing. So I want you to enjoy it. That's more than anything. I want you to enjoy this, and I want you to feel this, because I feel like this has been missing for a while, right? Let your body feel it. Let it just kind of be. Be vulnerable with your husband or whoever you need to be. Let it out, because that's going to be a part of the healing as well too. Don't keep anything in. You'll just delay your healing more. Let's do some rechecks, okay?
Okay.
One more. Let's have you look to the right again. 100% left. Let's go. Look straight. Let's have you look up to the ceiling now for me.
Wow.
Yeah. Down. Look down. Yeah. How does that feel?
Great.
Great. And try and touch your toes again. We got the toes. Good.
Totally.
How are we feeling now?
Good. Do you know what? I used to be flexible.
Yeah?
Actually, like in my early 20s, before any of this, I went to Australia, and one of my like party tricks was to put my feet behind my head. And I kind of forgot I could do that.
Yeah.
I don't think we're gonna get back there,
That's
but
okay. Yeah. Who knows? You never know.
I like
You might.
maybe.
You might, right?
I guess I haven't really been able to even touch my toes in a long time.
I know. I had to think back. I was like, did she touch her? No, she didn't.
No, I
You were like right
I
here.
was close, but
Yeah.
that like this is very easy. Now I can like,
You got the floor.
my hamstrings are a little tight, but that's not you.
Yeah. I want you to explore this. I want you to walk backwards 5-10 minutes. How long are you going to be here for?
A week.
A week. Amazing.
Yeah,
Let's
should
get
I
this.
be seeing you
Yeah,
again?
see me again. See me again. Let's
Okay.
all put you on the schedule. I come back on Tuesday, so we can try to fit you on Tuesday, Wednesday,
Okay.
Thursday, something like that.
Okay.
Yeah, I want to see how you're doing afterwards. Lay on that block continuously. This isn't over yet, right?
So there's no like start at 2 minutes and move up?
There
Or-
is. We'll show
okay.
you. Not even just 2 minutes. Like if it's 30 seconds and you're like, stay 30 seconds.
As soon
That's
as it starts to.
Yes, as soon as you're like, that's too much. Come off of it. Maybe not today. Relax today. Tomorrow, start doing it. 30 seconds. Stay on 30 seconds until like 30 seconds is good, or 20 seconds until it's good. And then work your way up further, and further.
Okay.
I think we unleashed a lot of things that have been locked in there. There might be some emotions that come out later. There's going to be a lot of toxins that come out after that, because there's a lot of energy that was just stored in there too. Drink lots of water. Have a great day today. All right.
Thank
You're
you.
awesome. I appreciate you coming.
Thank you.
Yeah.
Thanks so much.
One more question. Changes you feel. I always like to ask that you felt compared to walking in, and how you feel right now.
I just feel really balanced.
Oh,
Like I feel
hey.
solid, and I'm not wearing my glasses,
Mm.
right? And the glasses have just come since the accident, like a balance thing.
Wow.
But I don't feel like I need them right now.
So we helped you with your eyesight.
Maybe. Like I probably
Yeah.
would need them reading still, but the prism part of it was because my balance was off to the
Yeah.
right, and I feel really grounded.
Amazing. Hey.
Like I want to just go to the beach and like walk like barefoot in the sand.
Do
and
it.
Kind of like feel steady.
Yeah.
You know?
Do it. I appreciate you.
Thank you so much.